The provision of health information to patients is an important and significant part of providing good healthcare. Patient information is central to informing and inspiring doctors in their daily individual practice and empowering patients to make informed decisions in their health. First established in 1997, the BMA PLG Patient Information Awards celebrate the incredible impact that charities, patient groups, and trusted patient information sources are making to the lives of patients everywhere. The awards encourage the production of high-quality, accessible, and well-designed patient information and highlight the importance of good communication in patient care. They are supported by over 100 charities, patient groups, and trust patient information services. Before we celebrate the success of this year's winners, here are some testimonies from members of the patient information community reflecting on why the awards are so important.
High-quality patient information has the ability to dispel myths that exist around problems. They have the ability to help people feel less alone. They inform, they educate, and they are crucial to our ability to care for people.
PLG play a big role in the awards. I sit on the steering group along with the chair of the patient liaison group. An excellent resource that we've used as a family is the STARS information pack, which has been put together for children and families living with reflex and oxic seizures. I was thrilled, therefore, to see that one of their materials has been highly commended in recent years in the PLG Patient Information Awards.
I've worked as a physiotherapist in the NHS for over 20 years with adults affected by the chronic inflammatory condition axial spondyloarthritis, or AS for short. I was absolutely delighted when back in 2019 the BMA recognised the Axial Spondyloarthritis Know-How Self-Management Toolkit, or ASK, as Patient Information Resource of the Year. All good services are designed with our patients at their very heart, and I believe that patient information resources should be too.
PIF has been involved in the BMA PLG Patient Information Awards for over 11 years. We are the UK membership organisation and network for people working in health information. If 2020 has shown us anything, it's that trusted, evidence-based, accurate health information has the power to save lives. Health information professionals are needed now more than ever. Congratulations to every entrant to the awards this year. Providing health information quickly and efficiently during a pandemic requires skill and expertise. Thank you for everything you do.
I'm so pleased that we are here to recognise amazing work that has been done to help inform our patients.
Particular congratulations to those that have been shortlisted. Good luck.
Good afternoon. My name is Dr. Chand Nagpal, and I'm the chair of the British Medical Association's UK Council. I'm also a general practitioner. I'm delighted to welcome you to our annual event celebrating the 2021 BMA PLG Patient Information Awards. I'd like to thank all of you for joining us in this new virtual format, especially to the patient information professionals who do so much good work in producing resources which aid patient decision-making. The BMA Patient Information Awards was first established in 1997 to encourage the production of accessible and well-designed patient information. The provision of information to patients is an essential part of providing good healthcare. For doctors like myself, it's about considering patients as partners in their care, allowing them to make informed decisions, aiding them to follow treatment advice, and empowering them to self-care and manage their own conditions where appropriate. It is central to a healthy doctor-patient relationship. In what has been such a difficult 15 months of the pandemic, the importance of accessible and competent patient information could not have been clearer. We at the BMA are proud and honoured to champion and celebrate high quality patient information, and in the words of one of our previous winners, this encouragement can only help to improve national standards and assist all of our patients when searching for trustworthy content. With over 260 resources submitted on a diverse range of topics, this year's awards will be celebrating a long list, short list, and overall winner in a refreshed format. Last month, we announced the 10 resources longlisted for this year's awards. Today, we will announce and celebrate the shortlist of 5 patient information resources. Before we announce today's winners, we will be joined by the chair of the BMA's Patient Liaison Group, Chrissy Douglas. This year, the awards have also been renamed the BMA PLG Patient Information Awards in appreciation of the Patient Liaison Group's mission to represent an informed patient view within the BMA and the group's increasing participation in the awards. We will also hear from Catherine McCarthy and Dr. Jeeves Wijayasuriya, who will talk about Medical Aid Films project to deliver COVID-19 health information on Black and Asian ethnic minorities, migrant and non-English speaking communities across the UK. More than just an afternoon of celebration, this event will provide a platform to learn more about the impact that charities, patient groups, and trusted patient information sources are making on the lives of patients. I'm sure we will all be inspired by the enduring legacy of these resources across so many areas of healthcare. Please do follow along and tweet us from wherever you are using the hashtag BMAPI Awards. Thank you. Right, so next, I'm very pleased to welcome Chrissy Douglas, who was appointed as the chair of the BMA's Patient Liaison Group in October 2020. The PLG provides an informed patient view to a range of BMA committees, including our council, in informing our policies, so that we're cognizant of the patient perspective. And we also welcome the PLG highlighting areas of patient concern to the BMA. Patients are at the heart of our lives and define our existence as doctors. They are our allies and partners as we look after them. I'm proud of the work of our Patient Liaison Group and their invaluable contribution to the functioning of our association. Chrissy's professional background spans many disciplines: healthcare, science, the arts, and undergraduate and postgraduate education. She became involved in improving the quality of the patient pathway after becoming involved in her patients' care towards the end of their lives and her own experiences as a patient. This made her increasingly aware of the impact of effective communications and a caring environment on the outcome of her treatment. Welcome, Chrissy.
Thank you, Chand.
So, Chrissy, the BMA set up the Patient Liaison Group in 2004 as an internal reference group. Could you tell us a little bit about the PLG and its work?
Yes, thank you, Chand, and thank you for your support and your generous introduction. As you say, we're an internal reference group and we aim to formally embed consideration of patient experience, perspective and values across the BMA's activities. We're a mix of doctors and patient and carer representatives from diverse backgrounds. Our core values are diversity and inclusion and promoting health and social equity. We embed these considerations into the work of the BMA through sitting on committees, so branch of practice committees, professional and specialist committees, as well as commenting on policy documents. We have our own independent priorities, which include our annual symposium, which took place last week. We focused on improving access to care as a route to addressing health and social inequity. And next week, we've got a joint meeting with the patient group of the Canadian Medical Association. But I think the Patient Information Awards really embody our shared aims and our shared values in improving the quality of patient information for everybody.
Yeah, thank you very much. And in terms of the PLG and its role and involvement in these awards, do you want to just say a little bit more about that?
Yes, well, it's a real team effort across the BMA. As part of the excellent diverse steering group, we're involved in setting criteria for evaluation and judging. And central to that is this idea of collaboration and co-production, this bringing together of experiential evidence and knowledge with medical and healthcare knowledge and expertise, as well as, importantly, cultural, social, accessibility insights. So we're bringing together everybody with a real focus on accuracy, inclusion, dissemination across all patient information. We're assisted greatly by a team of volunteers, of doctors and patients and other healthcare professionals who review all the resources. We then, Maria Clark, co-deputy chair of the PLG, chairs the long listing panel. We have a short listing panel, and eventually a winner emerges. And I know it's traditional at awards ceremonies to say there's been a high caliber of entries, but there absolutely has. It's been a very difficult process at a time where we've never needed accurate, trustworthy sources of information more.
Thank you very much. A really comprehensive process, and thank you for all the work you and the team have been doing. And the awards have formed an important part of the work of the BMA in promoting collaboration with patients and to empower them as part of quality patient-centered care. So what do you think, Chrissy, of the importance of celebrating good quality patient information?
Yeah, Chand, I definitely think there's every reason to celebrate this from a patient point of view. Accurate, trustworthy, inclusive information can be transformative. It can improve healthcare outcomes. It can save lives. It can empower people to be more active in their care, to be more active in shared decision making. It can improve accessibility to resources, as well as more efficient use of resources. And I think there's every reason for the BMA to celebrate these awards today, because it shows your commitment to high quality patient care, your commitment to collaboration and to co-production. And I hope it inspires BMA members, indeed everyone watching today, to both use these resources and hopefully to produce their own. And I think for everyone who submitted a resource, all the groups, trusts, third sector organisations, community groups, patient groups, I think they'll join us in celebrating what we're doing today.
Thank you. And I'm sure there are many examples you can give, but can you just think of one just to give a flavour of how valuable information is for patients?
I think any patient who's received high quality patient information will attest to its transformative qualities. And my family, my parents, actually my mother in particular, was hugely benefited from patient information when my father was diagnosed with a long-term progressive illness. It gave her great information about prognosis, about diagnosis, outcomes, treatment. But for her, there were two significant things. The first significant thing was it empowered her to take part in decision making in his care, and enabled her to feed his values, their values, and their treatment preferences into his care. And that was so important to her. And in addition, so many people experience illness in isolation, and this is what happened for her in her community. Despite the fact they'd lived there for 50 years, they became very isolated. And the patient information she received provided a framework to start conversations with neighbours, with other community members, and signposted her to community groups where she realised she wasn't alone. So from a personal perspective, it was invaluable.
Thank you very much for sharing that. And of course, the coronavirus pandemic has highlighted the importance of evidence-based patient public information. So why do you think it's accurate, inclusive patient information from trustworthy sources is so important?
Yes, no, I agree, Chan. The pandemic has shone a light on what we already know, that, as you say, evidence-based, trusted, inclusive, accessible information is transformative. It's also shone a light on the power of misinformation and disinformation to cause harm and to break trust. It's also highlighted that not everyone in society has access to the same quality of information. So I think there's never been a greater need for what it is we're celebrating today, and that's accurate, evidence-based, inclusive information. So thank you, thank the BMA and everyone who's participated.
Thank you. So thank you. I'd like to thank you, Chrissy, for your leadership and active role in the development of the awards this year. So thank you very much.
Thank you, Chand. Thank you.
Next, we are delighted to welcome Catherine McCarthy and Dr. Jeeves Wijasuriya from Medical Aid Films. Catherine is the Chief Executive of Medical Aid Films, and Jeeves is a trustee at the charity. Jeeves is also a junior doctor and is a BMA council member. Medical Aid Films received a BMA giving grant in 2020 to produce a COVID-19 information animation, Getting the Help You Need, in multiple languages in order to deliver essential COVID-19 health information to Black and minority ethnic and non-English speaking communities across the UK. Now available in 10 languages, the film offers important patient information on medical rights, where and how to access services, and self-care strategies during this time of great uncertainty. The resource is intended to aid doctors and healthcare professionals to better support their patient communities who may be lacking access to COVID-19 information and messaging in their own language. Over to you, Catherine and Jeeves.
Thank you.
Thanks so much, Chand, and thank you for the lovely introduction. We're absolutely delighted to be here today to talk to you about Medical Aid Films project with the BMA, the work that's been done, and I think, you know, what we're going to do hopefully is try to have a bit of a sort of Q&A session, much like the one you've just heard with myself and Catherine. And hopefully what we'll be able to do is talk about how collaboratively we've been working to produce this, you know, this incredible content in multiple languages and the impact that that has had on the kind of communities that we've been trying to reach out to. I'm going to start us off with a question, if that's okay, Catherine. The first question is, asking you to tell us a little bit about medical aid films and the project that's been funded by the British Medical Association.
Thank you very much, Jeeves. And firstly, thanks to the BMA for the opportunity to speak today. And I'm just incredibly impressed by the range of projects shortlisted today. And I feel so honoured to be speaking today at this occasion. Medical Aid Films is a small NGO with a very big reach. We produce health education films on a range of global health issues with a focus on supporting vulnerable groups and women and children in some of the poorest countries. Our work is used in 145 countries around the world and has had over 20 million views online. Our BMA Giving funded project is our first project for a UK-based audience and a truly collaborative effort between ourselves and the BMA, aiming to deliver essential COVID-19 health information to migrant non-English speaking communities in the UK. The project came out of the need for accurate information for communities who may be lacking access to key coronavirus information in their own language. We were aware that there were lots of information around, but not enough material for communities being affected, which they needed in their language. So we created 8 animations in total in a range of different languages, including Urdu, Punjabi and Arabic. And this has been said in the introduction, covered essential COVID health information, including access to health services, self-care strategies for physical and mental health.
That's fantastic, Catherine. And, I think one of the things that we've talked about has been, also the change and adaptation of producing this kind of content from, international kind of settings from developing countries. How did you adapt this approach to cater to that UK-based audience? And can you tell us a little bit more about the process of doing that?
Yes, so people are often really surprised at how much work and how much time is taken to develop really high quality, factually accurate animations. And our approach is always, wherever we work around the world, whether it's in the UK or whether it's in many different countries, our approach is based around collaboration, developing an understanding of the audience and working closely with experts and reviewers throughout the process. And the collaboration with the BMA has been really critical to the success of this project. So just to run you through quite briefly some of the stages involved in creating this kind of work. We start with a pre-production phase, so formative research, audience and media mapping, and we obviously identify that all-important review group. We move then into a production and editing phase, developing scripts and storylines around the key messages and developing the style, characters, setting, colours and the drawings. And you can see the development of characters through these slides that I'm going to show you. And these have been developed by Neil Thompson from Alternative View Studios, who was a fantastic animator who worked with us on this animation and has worked with us on many. So in this first slide, you can see the first characters were developed while the script was being finalised. And we've just got 3 at the beginning, lots of discussion about how many characters and ages and style and what they would be wearing. In the second slide, if we can move to that, once the script was signed off, all of the characters were developed. And you can see we had 6 different characters. We wanted a mix of younger and older. We wanted to include men and women, and we wanted the characters to be drawn from the different communities that we were targeting. And all of our characters were referenced from photos and a lot of detailed research. So in slide 3, you can see that after discussion and feedback from the reviewers, the characters were amended. You can see the attention to the details. to the clothing, to scarves, to hair, to the length of tunic, to shoes. All of these details are extremely important in getting the animation right. Once the character is agreed, the storyboard is created. And in the next slide, you can see the character's body parts are drawn in separate layers so that they can all be animated. And you can just see here, the doctor's arm is ready for animation. And in the fifth and final slide, you can see the Sikh character here, who is ready to be animated, so ready for the movement. So once the animatic is signed off, the narration is then recorded. And we were incredibly lucky to have Krishnan Gurumurthy, who is one of the main journalists at Channel 4 News, record the English voice for us. This voice was then re-recorded and dubbed into different language and overlaid onto the onto the animation. Again, this is reviewed by our experts and panels at all these different stages, at script, at rough cut and fine cut. And finally, when everything is signed off, we move into the dissemination and evaluation phase. So we share the film widely amongst our partners, networks, and of course on our channels. And we look to measure the reach and impact of the work we've done. So it's not just about reaching people, it's about understanding, did the work make a difference and was it effective? And I think we're going to play you the final film in the background, although we're going to keep the sound down, although there are subtitles, so that you can just get a flavour of it as we continue to speak. Jeeves, back to you.
Thanks so much, Catherine. It's really fascinating seeing and understanding the effort. I think, many people in this audience will recognise from having produced, their own content as well, the kind of work that goes in behind the scenes to make sure it's right for that audience. I guess my next question for you really is, what do you think the key aspects are for creating that effective patient communication that speaks to those audiences?
I think the critical factor is, and the most important thing with creating any content, is to try to understand your audience. The closer you can get to what your audience needs and what they're looking for, what their information needs are, the better you will do to get your content right. So understanding audience is crucial. Collaboration is also hugely important for us, involving stakeholders in the project, in not just at the beginning, but through the development of the content, and those who are closest to the patient communities you're trying to reach. And finally, the importance of making sure that your content is accurate, is clinically accurate, but also relevant and speaks to the community you're trying to reach. And obviously, most important in this project is in the language that they will be able to receive it and understand it in. So thank you, Jeeves. I've now got a few questions for you. So we're turning the tables a little bit back on you. So I want to ask you, Jeeves, as a working GP, working with communities in Hackney, why is a film-based project like this so important for the medical community?
I think that one of the things that all of us will have seen certainly over the last year and a half, is just how clearly we see the disparity of health outcomes for people from diverse communities, from minority ethnic backgrounds, certainly global minority ethnic backgrounds. I think what we've also seen is how powerful misinformation and myths can be, and how pervading that can be in communities where it can be more difficult to get the right facts and information out. And I think that particularly working in as diverse an area as the East End of London, actually it's really tragic seeing how different those health outcomes are, how high the rates of things like transmission of COVID have been. And I think it has been a demonstration of just how undermined our public health efforts can be when actually we aren't managing to get into these communities and get the right information out there. And I think that was why it was so refreshing being involved in a project like this and seeing something that was bespoke and created for that context and for that audience that we often really struggle to get to. And if anything, because of COVID, our inability to get to people face to face, to visit them, you know, in kind of community centres, community groups, mosques, synagogues, religious places, because of our inability to do that in the same way, our ability to share information has been, you know, more challenging. So actually, digital resources have been absolutely crucial. But the constant problem with creating digital resources, often it isn't the right context or it isn't the right language for those communities. And that's why this was so powerful as something that we can disseminate and that we have ready into hand. And I think that's why the partnership with the BMA was so powerful, to give us that extra reach to clinicians, to help them not just know about the resource, but to have it to hand to use it. And I think that's a really big difference. And particularly when you're a clinician working in an area like the area that I work in, actually you really see the impact of things like COVID, and therefore you really do see the impact of being able to put those resources in and the benefits of that for those communities.
Thank you, Jeeves. And just sort of taking a step back to pick up a little bit more on one of the things you talked about there, you know, just tell us a little bit about what the impact of COVID-19 has been on the patient communities where you work.
I think probably the big thing to talk about is the high rates of transmission, the high rates of admission of people from those backgrounds and within those communities. You know, Hackney has remained an area that has, you know, throughout this period had incredibly high transmission rates. And part of that is patient information. Part of that is getting that information specifically into these communities. And I think that's why, you know, the work that we've done, not just with clinicians, but, you know, in the development of this film. And, you know, one of the things that I'm so pleased with this product about is that it's worked with people like the Hackney Migrant Centre, with local clinicians working in this area, you know, with so many of those organisations that we have set up where there is real need and demand for resources in contexts like this. You know, there's a list of some of the people that have reviewed this, that have been clinicians or public health doctors in this area, as well as the communities themselves, to make sure that we are producing the right kind of content for them. And I think that co-creation is so key, because if we were ever to try and make a dent in those high transmission rates and actually to battle what is increasingly in this day and age, that kind of giant of misinformation that exists out there, then it is content like this that is so important. It is content that helps, you know, families and communities understand and educate each other and share that information with one another. And for me, you know, that's the real impact that this work can have. That is what we see in so many of the information leaflets and videos and content that we've seen. And when you make it bespoke to those audiences, that impact is quadrupled, because it speaks to them in their context, in their language. And land so much better, because there is that feeling of belonging, and it addresses that isolation that often people have when facing these unknown things.
Thanks, Jeeves. And final question, what next? What would be on your what are the needs, and what would be on your wish list for projects like this? What do we need to do next?
Well, I mean, I think, you know, I think we've seen, and it's not just with this condition, we see so many of the patient information leaflets that have been, you know, shortlisted, and also just those that have been nominated and put forward, much like, you know, content like this. You know, there is a real need out there for high quality patient information. The impact it can have is absolutely huge. It is crucial and central to our ability to make complicated things understandable for our patients, to help, you know, speak to those fears that they have and those concerns that they have. And that needs to be done in, you know, a range of languages, because there are communities, you know, all across the UK where we cannot get information purely because it's not in the right context. So, you know, addressing those language barriers with content, creating content on a range of topics in the context that the patients, you know, will identify and understand them, is so crucial, and has to be the next step. And that's why I love these awards, because they showcase exactly that. And a crucial part of it in our armory, and actually during COVID, what has been such an important part of this period in terms of delivering healthcare. So for me, I think it's about reiterating the importance of this as something that, as a healthcare profession, we need to invest more in and do more in to try and access those communities, particularly where we often struggle to get that information across.
Thank you. And thank you, Jeeves, very much for your support for the project. And thanks to the BMA for the incredible opportunity that we've been given to create this work and to work with you. It's been absolutely fantastic. Please, everyone, go to our website, get in touch with us and think about how you can share the film and discuss others and work with us in the future. Huge thanks to everyone.
Fantastic, and a huge thank you to BMA Giving as well, who look after that grant and awards process, and just for their continued support all through this. Please do disseminate and share the resources that you see today, because honestly, they're really fantastic tools. Thank you.
Thank you.
Thank you so much, Catherine and Jeeves, for such an interesting and insightful presentation. So ahead of the shortlist announcements, we will now have a short 10-minute break. I would encourage you all to find out more about this year's longlist work by visiting the ceremony programme. Please do follow along and tweet us from wherever you are using the hashtag BMA PI Awards. Thank you. Welcome back. We will now be moving to the shortlist announcements. This year, the Patient Information Awards has had an unprecedented number of applicants. With over 260 resources submitted on a diverse range of topics, this year's awards will be celebrating a long list, short list, and overall winner in a refreshed format. Last month, we announced the long list and published the details of the patient information resources on our dedicated awards webpage. To all this year's long lists, congratulations. You should be immensely proud of your achievements. I would encourage you all to find out more about their work by visiting the programme. To better understand the impact that patient information resources have on patient care, we have selected 5 shortlisted winners whose work we will specifically showcase with short video clips. Let's start with our first shortlist announcement of this afternoon. Congratulations to About Neonatal Care by Bliss. This resource supports parents when they first arrive on the neonatal unit. It explains how neonatal care works, the care your baby might get, and how you can parent your baby on the unit. The panel commented that it is a fantastic resource that provides so much information to new parents when it is most needed. Let's hear some more about this resource from Amy Louise Murray at Bliss.
My name is Amy Louise and I'm from Bliss. Bliss is a leading UK charity that supports families of babies born premature or sick in the UK. We entered the BMA PLG Patient Information Awards because we believe that About Neonatal Care is a unique resource that is accessible to all parents with a baby or babies in neonatal care. Every year, over 100,000 babies are cared for in neonatal units in the UK because they have been born premature or they have been born at term but sick. This means that around 1 in 7 babies born in the UK each year are admitted onto neonatal units. Some of these babies spend months in hospital before they are discharged home, and sadly some of these babies do not survive. Our guide aims to support people with the many questions they might have when first arriving on a neonatal unit, in a way that is accessible and easy to digest. In addition to this, About Neonatal Care provides parents with an opportunity to write down thoughts and questions during their neonatal care journey. At Bliss, it is important to us that our information helps parents to feel more informed, more confident in their baby's care, less isolated, and more involved. We know that factors such as ethnicity, the age of the mother, and the economic situation of the area of birth can also increase the risk of neonatal death. Because of this, we have ambitions to reach more and more diverse families. This would include us developing the resource in other languages and formats, so that more families can access it in the way that best suits them. Parents often tell us that our information and about neonatal care helps them to feel less alone. One mum told us, "After having healthy pregnancies, to suddenly not be able to carry to term was isolating and bewildering. I felt like I'd failed somehow. Then I read a Bliss booklet given to me, and it was the first time since I'd given birth that I didn't feel alone." One of my favourite pieces of feedback from a parent about this information is a dad who told us they got the balance completely right, gave us hope but managed expectations. This is so important to parents who are navigating such a challenging and confusing time with their baby or babies in neonatal care, and we are honoured to be able to reach these families. As we are not a big charity, receiving this award will not only provide us with well-earned recognition of our commitment to supporting these families, but will help us greatly in our aim to reach more families through further funding and to continue to provide high quality, reliable and supportive information. Thank you very much.
So now moving on to our second shortlist announcement. Congratulations to Prostate Cancer Tests and Treatments, a guide for gay and bisexual men by Prostate Cancer UK. This booklet provides information for gay and bisexual men affected by prostate cancer, as well as their partners, family and friends. The resource is specially tailored to support their needs. The panel commented that this coordinated leaflet has been written in a sensitive manner and provides vital information in a balanced and solutions-focused way, disseminated brilliantly with a fantastic impact. Let's hear some more about this resource from Emily Robson at Prostate Cancer UK.
My name is Emily Robson, and I'm a freelance health information officer at Prostate Cancer UK. Our information for gay and bisexual men was produced initially to fill an identified unmet need. We know from anecdotal feedback and an emerging body of research that gay and bisexual men do have different experiences of prostate cancer than heterosexual men. The impact on sex and relationships can be different, and we know that there is still stigma attached to talking about sexuality, particularly when it comes to disclosing this to health professionals. This means that many gay and bisexual men feel under-supported and therefore don't receive the right care and support that they need to live well. Our information includes a booklet, a webpage, an awareness postcard which highlights risk, and some online real-life stories which detail the experiences of other gay and bisexual men with prostate cancer. Our aim for all of this information is to provide gay and bisexual men affected by prostate cancer with the tailored information and support that they need to live well. We hope that our information booklet will inform and empower gay and bisexual men, and we hope that it will provide answers to any specific questions or concerns that they have, and we hope that it will give them the confidence to communicate well with health professionals and ask for support when they need it. We know from after evaluating the information that it has had and continues to have a significant impact on our users. Feedback from users is consistently positive, with one person describing the content as factual but non-judgmental. We also know that this information is trusted by clinicians because we worked with a range of health professionals in the co-production of this information, most of whom specialised in LGBT health and cancer care. Thank you to the panel who read our application and considered this resource for what is generally an under-supported user group to be a high quality and impactful patient information resource. We're delighted to have been shortlisted, especially during what has been a difficult year for charities. I know that we all feel really proud to have been recognised at this year's BMA Awards.
Okay, so now for our third shortlist announcement. Congratulations to the End of Life Care During Coronavirus Hub by Marie Curie. This film supports the family and friends of someone who is dying. It explains in an accessible and reassuring way the common changes that people may experience towards the end of life. The aim is to make the future seem less frightening and help people feel more prepared and better able to cope. The panel commented, "This is a sensitively designed, high quality and empowering resource for those preparing for and planning their end-of-life care. A genuine focus on the patient and their needs will be of benefit to so many." Let's now hear some more about this resource from Matt Williams at Marie Curie.
Hi, my name is Matt Williams. I'm the Head of Information and Support at Marie Curie. We provide frontline nursing and hospice care all across the UK. We have a wealth of information and support about dying, death and bereavement. When the UK went into national lockdown in March 2020, there was a huge impact on Marie Curie's services and the people that we support. Our hospices were affected by outbreaks of the virus. Many outpatient units and day therapy units had to close, and our nursing service and hospices were impacted by shortages of PPE, staff illness, and having to work in a new and challenging environment. Meanwhile, the people that we support, even those who we hadn't heard of Marie Curie, had more questions than ever. We saw many of the inquiries to the support line were related to visiting a loved one and specifically visiting someone who was dying. Our callers wanted to know if they were allowed to visit someone, what the government guidelines were, if they'd be stopped by police, and what precautions they should take if they would visit. At the time, there wasn't any clear government guidance on visiting someone who was dying. Many of our supporters' questions were left unanswered, and we know that they felt stranded and isolated. Some of our face-to-face services were no longer open, so another avenue of support was unavailable to them. We decided to make the End of Life During Coronavirus Hub to provide a place to answer these questions. We also wanted to create a space of support for those missing their usual face-to-face services. The hub is aimed at anyone caring for someone at end of life. We know that's mainly family members, friends and partners. It's not aimed specifically at people with coronavirus, although it does contain information on symptoms of coronavirus and how they may affect you at end of life. We didn't know what impact we'd have when we started the Coronavirus Hub. We didn't know what the demand would be, but over the months we've seen huge demand. It's amongst our most visited pages on our website. We've seen it's made a real difference to the people that have accessed that information. We're really proud of that. We worked quickly and collaboratively with other teams across the charity and in other parts of the UK to make sure that we continue to meet the needs of our audience as rules and guidance across all 4 nations changed. I want to give you some examples now about some of the ways that people have used our services and how the project has impacted them. This is a verbatim comment from someone who has used our website and accessed our funeral information pages. I found your pages extremely useful. It's given me a lot of new ideas. Dad was an extremely popular man, and we've been really struggling with knowing how to hold his funeral safely while wanting to include as many people as we can in some way. It has really given me some comfort at such a distressing time to know what is allowed and what isn't allowed. We changed the perception of what good patient information can look like within our organisation. Traditionally, that means long projects, detailed work of multiple stakeholders that can be quite slow, but we wanted to showcase how responsive and rapid we could be with our information to answer people's questions in a timely manner, while still upholding the key principles of patient information, being evidence-based, having expert involvement, user involvement, as well as being accessible and inclusive. We're proud to continue that agility and continue to update the Coronavirus Hub as often as is required.
Next, our 4th shortlist announcement. Congratulations to Ollie the Brave, Back at School, and the Wibbly Wobbly Tummy by Molly Ollie's Wishes. This is the 3rd book in the Ollie the Brave series. The story aims to help children explore feelings they may experience when they have been diagnosed with cancer and to help understand their treatment. The panel commented, "An excellent piece of work with real potential to improve outcomes and the experience for some of our most vulnerable children." Let's hear some more about this resource from Rachel Ollerenshaw at Molly Ollie's Wishes.
Molly Ollie's Wishes is a charity that supports children 0 to 18 with any life-threatening illness. Molly Ollie's Wishes was founded in 2011 by myself and my husband Tim, following the death of our daughter Molly at the age of 8 to cancer. She had been diagnosed with a Wilms tumour at the age of 3 in 2006. And throughout her illness, Molly had been involved with various organisations such as the Click Sergeant Youth Advisory Group, and was also involved in a project that was set up by Bristol Hospital and Birmingham Children's and the Queen Elizabeth Hospital that was working with Aardman Studios of Wallace and Gromit fame. And it was a short animated film called One of a Kind, A Guide to Radiotherapy for Kids, that was designed to help children understand their radiotherapy treatment. Molly was the narrator of the film. And it was from these experiences and our love really of bedtime stories with both Molly and her siblings, and what we felt was the lack of good child-friendly resources at the time, that led us to produce Ollie the Brave. And Ollie the Brave is a soft toy lion that has his own Hickman line and also a detachable mane. And there's a series of books that accompany Ollie. And they start at the point of diagnosis and go through Ollie's treatment journey. What was really important to us in doing the books was they felt like a normal children's book and not a hospital pamphlet. They needed to look and feel like any other children's book in how they were written, illustrated, their size and the feel and quality of the paper. It had to be a character that children would connect and engage with, and it needed to help children try and understand what was happening and to help open up conversations and to help children feel less isolated. In Ollie the Brave, back at school and the Wibbly Wobbly Tummy, Ollie is returning to school after having spent time in hospital, and the changes and the emotional feelings that can result. The books are distributed via hospitals, community nurses and play specialists. All can be requested directly from the charity website. They are a free resource to ensure that we provide support to all those in need. Children with a serious life-threatening illness and their families face extremely challenging circumstances. Every situation will be unique, and having a variety of good resources to suit individual needs is important. As a small organisation, we feel that entering the BMA Awards can help raise awareness of our work, but also really highlights the importance and the value of high quality patient information. So thank you to the BMA for the awards and to all those involved. And we'd just like to share with you now a couple of pieces of patient feedback regarding Ollie the Brave, Back to School and the Wibbly Wobbly Tummy.
Okay, so last but not least, we will now announce the final shortlisted resource. Congratulations to the MND Buddies Activity Hub by the MND Association. This resource is for children who know someone diagnosed with motor neuron disease. The online activity hub helps children understand how MND can affect how someone walks, talks, moves, eats, drinks, thinks, and breathes. The panel commented, a wonderful resource, engaging, with clear language and very interactive. Fantastic. Let's hear some more about this resource from Kay Stevens at the MND Association.
Hello, I'm Kay Stevens, Care Information Manager at the Motor Neurone Disease Association. With MND, no individual has exactly the same symptoms at the same time or the same speed. But for most, it will affect how they walk, talk, eat, drink, move, and eventually breathe. And for some, it will affect their thinking and behaviour too. It's progressive, it's life-shortening, and there is no cure. It changes everything. Over the last 5 years, one of our core projects has been to improve our offer for children and young people of affected families, including our online hub, MND Buddies. We wanted something that would appeal to all affected children, including those in wider family circles, and our main aim was to help children feel involved and informed, to adapt to change and build resilience. But we also wanted to help the adult family members too. Our families helped during development and even chose the name MND Buddies. Here, children have a safe space to explore where they cannot be contacted without links to other sites. Our MND Buddies are Rinny the Rabbit, Carly the Cat, Max the Monkey, Eric the Elephant, and Ali the Alligator. They act like little guides, taking children around the games, the stories, the creative galleries, and age-appropriate information. And the hub is also supported by a storybook, Why Are Things Changing? And here are 3 children affected by MND who are some of the first to go exploring with the MND Buddies.
My favourite buddy character is Ali. My favourite buddy character is Rinny. My favourite buddy is Carly. I like Amina's feast because she's kind to her grandma and her grandma can't speak, so she has a special tablet that speaks for her and she makes a nice feast for her and her grandma says it's delicious. And I also like feast.
After using the hub, feedback tells us that children feel empowered to ask questions and also to ask for help for their relatives. As one young boy said, because Grandad has MND and he can't do this task anymore. Children are also using the site to cope with loss. As one parent told us, I didn't really anticipate how severe the effect of my mum's death would be on my young son. I didn't really have time to think about anything. But MND Buddies will surely help a lot of children. Our thanks to the families, experts and funders who all supported us, all gratefully acknowledged on the MND Buddies Hub. Without you, we could not have accomplished this project. And our final thanks to the British Medical Association and the Patient Liaison Group for raising awareness of innovation and good practice with patient information.
To all of this year's celebrated winners, congratulations. You should be immensely proud of your achievements. I'm sure you would all agree that we have heard from an inspiring range of patient resources this afternoon. Finally, to announce the overall winner, I would like to welcome Chrissy Douglas, our PLG chair.
Thank you, Chand. It's a huge honour to be announcing the winner of the BMA PLG Patient Information Awards. The winners demonstrated outstanding co-production, has focused on the unmet needs of a group of people who have felt unsupported, who've had differential access to and experiences of care, and who have also faced barriers and stigma in accessing support. They've actively listened and listened with humility to offer tailored support to this group of people. It's a great pleasure to announce the winner is Prostate Cancer Tests and Treatment, a guide for gay and bisexual men by Prostate Cancer UK. We're delighted to welcome Emily Robson and Anna Seawood on behalf of Prostate Cancer UK to accept the award live.
Thank you, Chrissy. I'd just like to start off by saying thank you again. To be recognised in this way by the BMA is a real honour, especially given the strength of the competition this year. We've all just seen such an excellent shortlist of resources, and it's been so inspiring to hear about each one individually and the work that's gone into producing each one of these high quality patient information resources. Personally, it makes me feel really proud to work in a sector which is so patient centred and alongside everybody here who cares so much about making health information accessible, informative and meaningful for their individual intended audiences. Thank you to the BMA for hosting this afternoon's virtual ceremony and bringing us all together to showcase and celebrate examples of high quality patient information. I think it's given us all the chance to stop and come together and reflect on what has been a challenging year. It's given us all the opportunity to look back at all the work that's been produced, which has continued to provide consistent and much needed support to patients and the public through such uncertain times. This year, more than ever, it's been so important to have clear, accurate and easily accessible information and support services available to those who need it when they've needed it most. For us at Prostate Cancer UK, with this specific resource, it was so important that we included users right from the very start when we began to update it. When we reviewed the information, we wanted it to be led by the users themselves. We based many of our key changes and our decisions on new and emerging research, which we worked with health professionals to include. and also from feedback and insights that our users themselves told us. We gathered insights in a number of different ways. We sent a survey out to everybody who had ordered the booklet in the previous 12 months. And we also attended a support group meeting specifically for gay and bisexual men with prostate cancer. And we spoke to the group members there about their experiences. We also reached out to our supporter base and invited people affected by prostate cancer to give us feedback on the information content and on the design. We made an effort to go to the people who we knew would be using this resource the most, rather than waiting for them or expecting them to come to us. Involving users in the co-production of this resource was our priority, and I think has contributed to why it's landed so well and has had such a positive impact on the users. We know that after the information was updated, the number of booklet orders increased, as well as the number of page views to the website. We also created an awareness postcard off the back of this main booklet. During the evaluation of the previous version, we identified the most common digital search terms that people were using in order to reach our information online. And we could see from these digital search terms that people had concerns and questions about how sexuality and sexual preferences may impact their chances of getting prostate cancer. Therefore, we used this postcard to address these concerns and highlight risk, or in this case, lack of risk, because we know that being gay does not increase a person's chance of getting prostate cancer. The postcards have been taken to various different Pride events across the UK, and since they were produced, they've remained one of our most ordered and valued resources for raising awareness of prostate cancer. The booklet for gay and bisexual men is on the schedule to be updated again within the next 12 months. And as before, the priority will be to involve users and health professionals and base key changes on the most up-to-date evidence. These two combined will ensure that the resource continues to be shaped and developed into the most impactful resource that it can be for men and their families. I'm now just going to pass you over to Anna Seward, who's the Senior Health Information Officer at Prostate Cancer UK.
Thanks, Emily. I'd like to reiterate what Emily said about just what an honour it is for our resource to be judged Resource of the Year. It's amazing to be recognised by such a prestigious organisation as the British Medical Association, as it gives both patients and health professionals that extra reassurance that the information is of a high quality and that it can be trusted. It's also quite humbling, given the quality of the other resources we've been hearing about. I think any one of those, and I'm sure many others, would be really worthy winners. So we're really grateful to be recognised alongside everyone else today. It's already been said, but this past 12 to 15 months has really shown the importance of good, clear health information. I think everyone in this field has really stepped up to the plate, often having to adapt to different and more pressured ways of working with limited people resources and often without all of the answers ourselves. Health information might not be on the front line saving lives, but it does play a really important part in helping people understand their health and make decisions that are right for them and their loved ones. I often get asked when we're interviewing for people to join the team what the best thing about the job is for me. And really that's it. The knowledge that what we do is really making a tangible difference to people. Seeing Emily work so closely with some of those people to improve this resource was really special. It can be hard to explain to people who don't work in the field just why information does need ongoing development, particularly if there haven't been any clinical advances or changes since the last time it was reviewed. But I think this resource is a perfect example of something that was good to begin with, but that through working with the people it's intended to support, is now even more targeted and useful. We can't wait to share this award with them, as well as with the clinicians who work really closely with us, both those within the NHS and within our own wonderful specialist nurse team at Prostate Cancer UK, as I'm sure they'll all be as delighted as we are about it. I also just want to add that it's a bit of a reminder that there's still a role for traditional information. Over the last year, we've seen the uptake of digital information accelerate more quickly than we ever could have expected. And the opportunities that gives to reach more people and to reach them in really innovative ways is really exciting. But I think this award for us is a reminder that the core values of working with users to develop clear, evidence-based information that really works for them still apply, whether that information is print or digital or something else. We always just need to be led by the people that we're aiming to support. Thank you. Pass back to the BMA.
Thank you. And in what has been such a challenging year, we would like to again thank all of you for your involvement and for enabling us to recognise and celebrate these fantastic patient information resources. Our thanks go to the patient groups and charities who have supported these awards. I would particularly like to thank our volunteer expert reviewers who appraise each patient resource, and to the awards judging panels. We are very grateful for your help. I'd like to thank the chair of our patient liaison group, Chrissy Douglas. Chrissy and the PLG Deputy Chair, Maria Clark, have been extremely active in the development of the awards this year. Thank you very much for all you do for us at the BMA. Last but not least, our grateful thanks to the BMA Corporate Development and Conference and AV teams for their immense hard work in organising this celebration. Thank you for watching. To close the ceremony, we will now hear from the Lewisham and Greenwich NHS Choir.
Bright, bright.